a lot is changing even in the field of focal therapy, not just the imaging that we have that makes it better, but just our understanding of it and what to
Absolutely.
do is changing as well. Tell us, if you're a private practice urologist or you're part of a group and you're trying to adopt this and bring it in, what's the learning curve? Give it to us straight.
Yeah.
What training pathways are important, and how do you incorporate this into your practice?
Yeah, that's another great question. I think just to retouch and recap fast when I talk about having two modalities is important, right? And also having the ability to offer the radiation or radical prostatectomy is super important as well. But in terms of the physician standpoint, right, what do I really need in my skill set to understand how to do focal therapy? It's really understanding patient selection. And then when it comes down to the procedure, the benefit about focal therapy is almost every procedure that we use, whether it be IRE or whether it be HIFU or cryotherapy, uses ultrasound. And luckily, David, as you know, we use the ultrasound on a daily basis, right? So it's
Right.
really common, especially prostate ultrasound, right? Almost all of our biopsies are always done on prostate ultrasounds. So, HIFU, for example, uses a transrectal transducer, and it's done based on ultrasound. It's not foreign for me to understand where the apex and where the base is, where the seminal vesicles are, where the capsule of the prostate is. So in
Right.
that sense, it's really, really easy for a urologist to incorporate this into their practice. And we've looked into this, what the learning curve would be for most people. It's about 5 cases. So 5 cases. So it's really not hard, and it's really because it really hinges on the fact that it's very ultrasound heavy. It's very ultrasound based, and that's
Right.
not foreign to most urologists. So I think that's really the key point. They have to have an open mind, the understanding of how to use an ultrasound probe, which most of us do, and the ability to understand that patient selection is key. And those are really the three things that any urologist really needs to have or needs to learn to be able to incorporate this into their practice.
Great. And then in terms of, going forward, I guess this is a question that's going to be really relevant, especially with like what you said before about the way that things are changing in terms of focal therapy and how it's administered. What clinical trials are important that we should be looking out for? Anything on the horizon, anything coming up maybe at AUA, uh, you know,
Yeah, great question.
without giving away too many secrets.
Yeah, no, I mean, listen, I think this field is going to be where the next excitement, next frontier of prostate cancer is going to be, right? So when you look at some of the things that we're going to be looking at, I think coming up in the next few years, we're going to have the Captain trial, which is TULSA, which is the transurethral transducer, and that's randomized against radical prostatectomy. That trial is going to read out in terms of how we can use that device against radical prostatectomy. We have the PRESERVE trial, which I think they've hit enrollment, and that's IRE. We've not gotten the data yet. I think in the next probably 6 months to a year, we're going to really see that data come out. We also we have a couple trial concepts in place. I think I'm working on one with Focal One that's really looking at, it's going to be called the Clarity trial, and that's something that's looking at intermediate risk and how to either randomize it with active surveillance or radical prostatectomy with HIFU, and that's going to be a randomized trial. Hopefully in the next year or two that we're going to get that off the ground. That's going to be pretty exciting if we can get a good buy-in from every party on that one. And then we have other smaller trials. We actually are working with Blue Earth Diagnostic here at Hackensack, something called the SCOUT trial. That's an investigator-initiated trial where we're looking at the role of PSMA PET scans after focal therapy to really maybe negate the use of that 1-year protocol biopsy based on PSMA scans. So that's going to be really exciting to see how we can incorporate newer tools that we use for staging or diagnosis of prostate cancer and really be able to understand what's that actual niche in focal therapy. And it's going to really, really be exciting to see where all this data comes out. And what's exciting to me about all of this is we're going to actually have finally in the next few years level 1 data in this setting, and that's going to be really, really kind of be the next game changer in this field.
It really is exciting. I was by the SIRS meeting earlier this year, and,
Mhm.
and hearing Dr. Gill talk about, how many people are learning focal therapy, and like you said, it's in our toolbox already. It's there, and it's helpful, and it's going to treat patients, and it's going to do the right thing, and so these are the amount of patients who are taking urologists who are incorporating this into their practice is really exciting.
Yeah.
How do you see, last question, how do you see this changing in the next 10 years?
So I think, you just talked about SIRS. I think what's interesting is, Dr. Gill has been leading or is help leading this the Water 4 trial, which is actually through Procept, and that's one that they're going to look at, radical prostatectomy versus, whole gland aquablation. Really exciting. We're going to be a site here at Hackensack, so that's going to be another important trial of trying to offer something more minimally invasive than radical prostatectomy in the setting of prostate cancer. But one thing that I think is going to really be the most excitement and what's the future of this area is really going to be, you know, there is a lot of need in this area for something that's going to spare men for their functional outcomes, but have a good balance with oncologic outcomes. So this is going to be the future of prostate cancer treatment. Not everybody is going to be a candidate for this, but it's really important to understand that this field's not going anywhere. It's only going to grow bigger, and we're going to be able to offer it for more patients with better selection and better diagnosis. And I think as our tools become better, we're going to hopefully become better urologists. And I think furthermore, our patients are really asking for it, right? So we're going to be able to fill a need that we really need to both improve our cancer oncologic outcomes as well as really reduce our morbidity of some of the radical treatments that we provide for our patients.
That is great. On behalf of GU Oncology now, what a pleasure having you. This is awesome. Like I said, when we did this 2 years ago with another expert in focal therapy, I said we're going to be back here again because there's just so much changing. We're going to be back here in a year and a half, 2 years, with all the new updates. Thank you so much for your time, and
Awesome.
hope to have you again.